On July 22nd, my medical provider and I had a very frank conversation about my 6-year history with cancer, the setbacks that I continue to have, and my search for comfort over cure, which is not available to me. We do talk in specific detail about what my death could look like and the 3 avenues that it's likely to take. So I'm warning you now that while I'm prepared for this conversation, if you are not, I understand. But I wish I knew what this looked like before I ended up this far down the road. And so that's why I'm sharing with you now. So I've rearranged the conversation and used AI to mask my provider's voice. I really wish you could hear her gentleness and compassion. She could not have been more perfect.
So, you'd taken True Cap for 2 rounds before coming to Juno, and it sounds like things really hit hard after that. From your ER notes, I see you had lots of nausea, vomiting, and diarrhea. Not having anti-nausea or anti-diarrhea meds with you, it seems like things got out of control really fast before you had a chance to manage it. It makes sense that it caught you off guard.
Right. I didn't see it coming because for 2 weeks I had none of that.
What we usually see with True Cap is that once your body shows you how it reacts, those symptoms tend to be pretty consistent if they're not treated. So, if you did nothing and took the meds again, you'd probably have the same rough time. But now that we know how your body responds, and especially since your symptoms seem to kick in the day after your last weekly dose, we can plan for that. The good news is that we can help you tolerate the meds a lot better, especially because this is usually a really effective treatment, and symptoms often get better with time.
Right, but I
And I
think
know,
my question then is how much time? Because I thought I could have up to 2 years, which made it seem like it was a reasonable thing to do. But if it's only gaining me on average 9 months, I usually get like a third of what anybody else has ever offered. By the time we figure out how to manage this, it's not going to matter anymore, and I will have lost all the time that I have left here.
So, I think I understand where you're coming from. And just to be clear, my job isn't to convince you to take any medication. It's to help lay out your options and what they might look like for you. Your cancer journey has been going on since 2019, and I know that every drug you've tried so far has either been really hard on you or only successful for a short time. So your question, what's the point of this, makes total sense. There's no perfect scientific answer I can give you. Data and statistics can't fully capture your unique experience. The reality is, we know this cancer will shorten your life. We can look at averages and say, here's what it typically looks like at diagnosis or after recurrence. But in truth, there's no crystal ball. We just don't know exactly how things will unfold. So it really comes down to this. How do you want to spend your time? Hoping to extend your life, actively stalling the cancer, and reduce cancer-related symptoms? Or would you rather focus on comfort, choosing to manage symptoms as they come, even knowing that it might mean a shorter timeline?
That's where I fell until I heard about this medication. Actually, it wasn't even this medication. I think some things got conflated because my New York oncologist thought that I was eligible for a different thing. And I think that's where my 2 year span came from. And then it was like, well, no, but let's try her on this. So many variables. I think by the time I dialed it in, I will have wasted the one summer I have. And I want to live fast and die hard and leave a beautiful corpse, right? Like, I'm not looking to live forever. I mean, they told me before I tried any intervention that if I did nothing, cancer symptoms would show up by fall. And the stuff that we did gave me use of my spine back. I think we probably bought us some time because as hard as these meds are on me, they're that hard on my cancer too.
Yep.
So I feel like that's enough of a go to try.
Okay, and I'm going to say this back to you because I want to make sure I fully understand. While these drugs could work and extend your life, the side effects are not worth that to you in terms of impacting your quality of life, even with a very clear regimen of anti-nausea meds, anti-diarrhea meds. You don't want to try because it was too traumatic the first time.
It was so hard, and I'm going to be tied to medicine bottles and clocks, and I want to be out on a kayak and not have to worry, should I bring my meds, and is it on time, and are we back in time if I didn't? Like, I just want to
Yeah.
be free.
I hear you, and there's no right answer to this. From the oncology perspective, we are perpetual optimists that we can find something that's going to fight cancer that you can tolerate. That is the optimism. That's not always the case. And there's always those drawbacks. So that means you're going to have pill bottles with you. You're going to have a watch on your wrist with alarms set every 6 hours. You're always thinking about what to
Okay, do I
take.
take the ondansetron 30 minutes before the pill, before the breakfast, before the... Oh
Yeah.
my God.
It would be a schedule, and we can write that for you to make it easy. But it sounds like ultimately your priorities are not the drugs, and not the lab draws, and just focusing on living your life while you feel good.
The other side of it is the injections. I mean, I walked over half wondering if I was going to do it and half wondering if I was going to tell her no. And
Yeah.
I walked in and I was just like, I can't. And part why I can't is because when I had to take injectable Humira and I did it on my own, it felt like putting a cigarette out on my thigh. And
Mm.
the trauma of doing 2 injections that are slower.
Mhm. Yeah.
The infusion center would.
I
But you're just talking about
understand,
the pain.
but it's
Yeah.
also worse because I'm not in control. And I don't know what those side effects are, and now we're going to pile those on top of this, and...
Mm.
Mm-mm.
Yeah, and while the side effects of fulvestrant are minimal, that's group data. You've historically had every single side effect of every drug. I think your focus on what feels meaningful now is completely reasonable. And I think you've probably heard this ad nauseum, that we're buying you time. We're not curing this. From our end, that trying to treat the cancer when you start noticing little symptoms is another option. There are things that we can do, drugs we can try, schedules we can create.
I am so grateful to have you in my back pocket. I am.
Yeah.
But I've also had 6 years to face this and didn't think I'd even get this far. So,
Yeah.
and it's been really good lately. And I don't
Mhm.
want to squander that knowing how bad I feel most of the treatment process.
I think the hard part is, the reason we've had 6 years is because of the little bits of chemo and the treatment you've tolerated. But you're at the point now where it sounds like you've got a lot of mental clarity, that you want to focus on feeling well for as long as you can. And when that changes, you can reassess.
There were times in the early stages that had I had I known more what the big picture would have looked like, I wouldn't have chosen what I did. I just felt
Yeah.
like sheep. I was being guided through and I had no bearings, and I just
Mhm.
did what people told me to do. And
Yeah.
I think my choices then would have been different if I understood. So I'm pretty solid on where I'm at. This is not
Good.
because of this medication.
I think it's hard because the reason we've had 6 years is because of the little bits of chemo and the treatment you've tolerated. So it's a weird catch-22 of how do we create more time? But you're at the point now where it sounds like you've got a lot of mental clarity, that you want to focus on feeling well for as long as you can. And when that changes, you can There's a part of this conversation I'd like to share with you, but it's a bit morbid, and I want to get your
Oh, I would so
permission.
appreciate that. That's going to help a lot.
So I want to go through your scans and pinpoint where the disease is to have a deeper conversation about what disease progression likely looks like for you. Obviously, nobody follows a blueprint, but I can give you a feel for what you might expect. I look for where the cancer is. What is it near? And that gives me more of an
What they
idea.
said before was that it's around my bowel loops.
Mhm.
They believe my ovaries are affected. Nothing in the liver as far as they knew, but there
Mhm.
were some spots in my lungs. And then everything that was in my belly was lower left pelvis.
So, let's talk about the symptoms that you're likely to have, how those will progress, and how can they be managed without medicine or interventions, or what interventions might be helpful. Okay, so while cancer does spread, usually the growth is more of the problem in the belly. Cancer kills people by way of a few different mechanisms. One, it's growing and taking resources away from other things. So people tend to feel weaker, more tired, worn out, and even though they're eating, they're losing weight. People look sick, thin, and frail, even though they're doing everything they can to eat. And that's one pathway of the body getting weaker.
So, quick question then, because yesterday and today I have zero energy. Is that the
Mhm.
meds?
I'd imagine it's the trauma of coming to Juneau, having multiple ED visits, losing everything you're eating by way of vomiting and diarrhea. So, your intake was not adequate for your output, and that can take a little bit to recover from. But I would not expect that to be from the medicine in your system now, nor from the cancer suddenly exploding with growth. So over the next few days, focus on hydration, good nutrition, rest but stay active, go for walks, slow dancing. So, we were talking about the pathway of that wasting syndrome. Cancer then also, when it grows, takes the place of healthy resources. Cancer in the liver blocks normal filtration. Cancer growing in your lungs starts to block airflow. For you, small spots in your lungs probably won't be a huge deal for a long time. It has to get pretty large and bulky before it causes problems. But the cancer in your belly, and especially in that left lower part, that's probably going to be the biggest issue. As that grows, especially around the bowels, it's going to stop them from rhythmically squeezing and moving things through. What that's going to feel like for you is a bit of constipation. You'll feel a little bloated. You'll have a decreased appetite. And when you do eat, nausea will settle in, usually within a few minutes, or even up to an hour after eating. As that food doesn't move through as well, you can start with prunes, applesauce, smooth move tea, bowel softeners, because softer stool is easier to move through than more formed, bulky stool. When cancer continues to grow and pushes on those bowels, it stops them from rhythmic movement entirely. Things will get stuck, they'll back up, and you're going to feel nauseous. You're going to have stomach cramping. Anything you put in your mouth, you'll vomit back out. Or you won't even eat and you'll still vomit because the bowels normally slew tissue. That'll build back up towards your stomach, and you'll start throwing it up. And that's what an obstructive process looks like. When that happens, a tube can be placed down your nose to offer relief. It sits in your stomach to alleviate some of that pressure. In a bit, the bowels may start moving a little. Adhesions can be addressed surgically, but tends to be pretty traumatic and not very successful when disease is the source. At that point, we have hard conversations about how aggressive should we be. So, as your disease progresses, look for a change in bowels over the course of the summer. That's a big one. Increasing fatigue and weight loss are slow signs that things are changing. But when you start seeing bowel changes, lower abdominal bloating or pressure, pain from the bowels hitting on other organs, I think that gives you more of a ticking time clock.
From Seattle anyway, but not to the level of detail. So I so appreciate that because I was craving that kind of knowledge. So yeah, this is really helpful.
Listen, enjoy eating whatever you like whenever you like, and know that everyone's bowels fluctuate normally. You may have some transitory constipation, but it's the trend you're watching for. When you do start getting constipated, be thoughtful about it. Make sure that you have the senna tea or prunes. Be proactive so things don't progress quickly. That's going to be one of your biggest risk factors. When those symptoms become significant and debilitating, it may be worth trying treatment to shrink those symptoms, because side effects of the medication, if we can create a good schedule for you and really get a good regimen, may in fact be more tolerable than the side effects of the cancer growing. Let's touch base in mid-September.
Just so you're aware, when it comes to that, we have relatives in Washington, and I've already made a plan that when it comes to the side effects of the cancer, to not live with symptoms of any meds or cancer. I will be employing their death with dignity laws, and if not here in New York, hopefully will come through and we have a home in New York. So
that's completely reasonable. The hard part is deciding when. Sometimes it's very clear, but where your cancer is growing, symptoms will come and go, so it's not so clear-cut. This is obviously downstream, but I want to be really upfront with you. Something to consider with how end-of-life medication works. You have to be able to mix everything yourself and swallow it yourself. I have no concern that you're going to be able to mix things, coordinate, and swallow. What you need to be thoughtful of are the major complications that we've talked about. Obstructive symptoms are probably the number one reason people progress towards death, as the contents of your intestines back up. The severe nausea and vomiting means you can't eat or drink. That means you won't have the 20-30 minutes it takes to absorb the medicated drink through your stomach and parts of the upper intestines. You can't do that if nothing's moving. There are ways that you can manage. You can have the tube I mentioned placed down your nose to decompress the pressure in your stomach, giving you some volume to play with. Then you're able to drink, even if your bowels aren't moving. This is a very morbid thing to mention.
No, it's not. I'm starting to understand.
Yeah, I just want to make sure you have the information. So, when those obstructive symptoms start, it's a very hard time frame to navigate. You'll need everything established and prepared to fall into place. You'll need to consider when to establish residency, to benefit from death with dignity laws, and manage your physical location. Haynes brings up a lot of challenges. You need end-of-life medication on hand. You'll need the hospital to insert the tube to relieve pressure, so you can travel and medication can be absorbed by your stomach and upper intestine over the course of 20-30 minutes. So, these are things to think about before the obstructive process starts.
Right.
It's just a weird kind of nuance. The other thing I should mention is feasible whenever you have disease not within an organ specifically, but in the spaces and coating things. There's always the potential it could also eat through or erode through structures and cause perforations and bleeding. Those are not things you can do anything about. Quite honestly, that happens all of a sudden. Like you're like, wow, I'm exhausted. I feel short of breath. My belly is swollen. It's worth getting an ultrasound and just knowing what's going on, because you're going to have a very, very short time period left, and you'd want to know so you can prepare for it. So I think hospice is absolutely appropriate in terms of access to medications and access to resources for both you and your family. The difficulty with hospice is that they're not going to do an ultrasound and getting the tube down your nose without a lot of advocating for it. Have an upfront conversation with the hospice team laying out, here are the interventions I could potentially need, and can we have that in the back of our heads? My goal is still very comfort-focused, but these are things I can do for my own comfort that also meet my long-term needs of reaching Seattle or New York.
Okay. Good to know. I so appreciate that.
Last thing, so let's say things stopped moving. Things are building back up. That is life-limiting, a short-term issue that doesn't resolve. You'll have to make some decisions. If you put the tube down and it provides decompression, it's then worth having conversation with your providers based on CT scans, whether you can leave the tube in for longer-term relief and travel to your death with dignity state and be able to end things on your terms. On the other hand, if things are just not going to move and you can't travel, you would die slowly from no eating and no drinking. It could take just days or up to a week or two. You'd get weaker and weaker. You'd peacefully fall asleep, and that would be it. No struggle or pain, so that is not inherently a bad death, as long as things don't burst or break. The worry with bowel obstructions is that, with enough pressure, you can perforate or rip the bowels, and then you've got a full-body infection. An abdominal ultrasound or a CT would be necessary to get a window into that type of event. First, tell your provider how things are changing. Then ask, what will this look like as it progresses? How am I going to feel? How am I going to die? What's the time frame? What does death look like from not eating and drinking? What does death look like from an obstruction? What does death look like from an infection? Because those deaths are very different.
Gosh, I'm so appreciative of this.
Yeah.
Please know, I'm always here to answer questions. And you're always allowed to change your mind. You have different medicinal routes still available to you, whether chemo or different drugs or a schedule of antiemetics. Just keep in mind, at some point, you will become too sick, and we can't give you any further treatment.
Okay. I will keep that in my back pocket.
And hopefully, you'll have a brilliant summer, a wonderful fall, a great Christmas, and sometime next year.
After the hooligan run.
After the hooligan run, absolutely. We can touch base again. All right, get out and go kayaking. Stay hydrated, get good nutrition, get good rest.
You've been so helpful. I really appreciate you. Supporting you through your treatment. Not going through treatment anymore. Daily medication tracker. Not taking medication anymore. Patient welcome booklet. I'm not a patient anymore. All the various side effect sheets. Not going to have side effects anymore. I'm done. It's time to trade hospital bracelets for all the bracelets of the Southeast Alaska State Fair. As doctor ordered. This is my new prescription. Don't tip.